Well, I wonder how your work is perceived by sort of, if I can say, mainstream approaches to dealing with PTSD. And it does occur to me, if this is such a successful therapy, that it should be more widely used because the costs of not successfully addressing PTSD are monumental in lives, in relationships, in the cost of dealing with addictions and other sort of results of having PTSD.
Really, but again, I think there's been acceptance. I think more and more people need to be exposed to it. I know on the service veterans, probably more of them die. Most units more die of suicide, than died in combat or even disease now. So this is a very, very, very significant problem. Again, these are anecdotes, and that's a hard to say. Does the animal assist therapy prevent suicides? But there are powerful videos. There's a video where a guy said he had service revolver out. He was about to kill himself, and the dog jumped on his lap and basically would not stop until he put the thing away. That's just an anecdote. Again, that's a very tough question to study, but I think it probably animal assist therapy does probably prevent suicides, which I don't think any other treatment is going to be proven to do. So I think it's very important. And even as people try drugs and they're going to be trying psychedelics and stuff like that, I don't think no one's giving up their dog for a psychedelic. I don't think it's much safer. So I think medicine, like I say again, I think this podcast can help too. It's something can be worldwide. I think this this goes to the sustainability goal 10 about reducing inequality, because many people can get a dog. I don't know if everyone can, but many people can, and it's cheaper than some other things. So I think I think that it helps with that goal too.
Yeah, absolutely. And Simone, I wonder, as Eric was saying, people are probably more familiar with service dogs for the blind. What kind of protocols should there be in terms of working with service dogs, and do you have to correct misassumptions about how they work in this kind of therapeutic process?
Yes, I do believe that even though we all can understand the connection between animals, and doctors, and we all can really see how they would help, there is still misunderstanding behind the laws and just behind the public's view in general. I think there's a lot of things that need to be cleared up, because a lot of individuals can bring their pets into public, and this might confuse the general public into thinking that any dog brought into a store is a pet. I've even at the VA hospital been told, with my dog with the service vest on, that clearly stated it's a service dog. I've been told that I can't bring my dog, my pet, into the hospital. So that's another reason why this book is so important, to clear up these misunderstandings and see the difference between a pet and an ESA, emotional service animal, and a service dog. I think that it's just going to take time. And also, I've had instances in public where I've brought Gunner with me, and I've had many people come up to me and say, "Thank your husband for his service." And I guess they assumed that, again, a service dog is only meant for male combat PTSD survivors. So I've had to politely, on my own, inform people on the reality that PTSD can occur in many situations, not only combat. And so it's just going to take time